Hello, good morning. Good afternoon. Am I audible?
Yes, you are audible, sir.
Yes. Okay. Good afternoon. Good afternoon, everyone, and welcome to AV Medialine, premier academic forum for medical professionals. My name is Dr. Sandeep Mohite, founder director of AV Medialine, and I'm honored to host this webinar today. Since our inception in 2017, AV Medialine has been dedicated to providing knowledge and skill to doctors from Maharashtra and beyond. As a vibrant community of over 4,000 doctors, more than 4,000 doctors, we strive to elevate the standards of patient care through continuous learning and professional growth. At AV Mediline, we recognize the importance of staying updated in the ever-evolving field of medicine. That's why we offer daily academic activities, carefully curated to provide our members with the latest insights, research, and best practices. Our mission is to bridge the gap between theory and practice, empowering medical professionals to deliver exceptional patient care, and to support doctors in Maharashtra in updating and upgrading their knowledge so they can deliver exceptional hospitality and care to their patients. By fostering a culture of collaboration, innovation, and excellence, we, we aim to make meaningful difference in the lives of patients and families across the region. We are proud to have assembled a diverse faculty of over 16 experts from various disciplines. Our speakers are renowned for their expertise and passion for teaching, ensuring that you receive the most up-to-date and relevant information. But don't just take our word for it. Our participants have consistently expressed high satisfaction with our academic forum, citing the quality of our content, the expertise of our faculty, and the engaging format of our sessions. Join us on this journey of continuous learning and professional growth as we explore the latest advancements, challenges, and opportunities in medicine. Together, let's redefine the future of healthcare in Maharashtra. Today's webinar is another exciting opportunity for us to share knowledge, insight, and best practice with you. We have an engaging program lined up featuring expert presentation, interactive discussion, and question and answer session at the last. So sit back, relax, and get ready to learn from the best. We are thrilled to have you join us on this educational journey, and we look forward to to active participation. Ladies and gentlemen, today I am delighted to acknowledge the remarkable contribution and blessings of Dr. Pravesh Grant sir, a renowned cardiologist from the prestigious Ruby Hall Clinic in Pune. Dr. Pravesh sir is a shining star in the medical field with a reputation of excellence in cardiology. Their dedication to providing top-notch patient care, combined with their passion for advancing medical knowledge, has earned them a well-deserved reputation as a leader in their field. I would like to request Dr. Padmanath Keskar, sir, our academic head of AV Mediline, please introduce today's speaker, Dr. Pravesh Grant, sir. Over to you, sir, please.
Thank you very
Hello,
much.
hi.
Hello, sir. So I
How
will
are
introduce
you?
you.
All fine,
Yeah,
all
fine,
fine,
sir.
thank
All
you.
fine. Yes. Your presence is most energetic presence, sir. So I will quickly introduce you and then we'll start our presentation. Sure. So it is our really a proud moment that Dr. Parvez Grant, sir, is on this platform. So Dr. Parvez Grant is a chief cardiologist, chief and managing trustee of Grant Medical Foundation, Ruby Hall Clinic, Pune. He is MD FACC USA, FSCI USA, FRSM UK. Under his guidance, three major branches of Ruby Hall are working efficiently. These three branches, everybody knows that that main Ruby Hall is at Pune station at nearby Sassoon. Another is the Ruby Hall Wanavdi and the Ruby Hall Amenora. All these three branches are doing very well, and where workforce of more than 4,500 dedicated professionals are working relentlessly. Along with this hospital, sir, under the leadership of Grant sir, 26 diagnostic centers all across Maharashtra are working where CT scan, MRI facility, and all the advanced techniques are available. And it is very proud moment for me to say that Ruby Hall is the largest cardiac center in Western India, where more than 4 lakh of angiographies and 1 lakh angioplasties have been performed yet, and more than 80,000 open heart surgeries have done. This is a really proud moment for all of us. Not only cardiac, but regarding the cancer center, it is very famous for the cancer management. It is one of the India's largest cancer center. It has a 10-story building, and all the state-of-the-art facilities are available at Ruby Hall Clinic for the cancer management. Ruby Hall Clinic is nominated as best hospital for medical tourism in India. Ruby Hall is doing lot of social activities. And I am really proud to say that almost more than 100 crore charitable work was done in last 4 years. And last year alone, 100 children underwent free open heart surgeries. So this is a very good thing. During COVID-19, Ruby Hall Clinic helped and treated thousands of patients. And the most prestigious Ramkrishna Bajaj Award for Excellence in Crisis Management was given to the Ruby Hall, because at that time, at any given time, 110 patients were continuously on a ventilator, and that was a very stressful moment for the doctor. Dr. PKG sir, along with his academic excellence, he have received so many national awards like Rashtriya Samman Award, Manibhai Desai Rashtra Seva Award, Lions Yuva Seva Ratna Award, Icon of Pune Award, Shantanurao Kirloskar Puraskar Award, Excellence in Cardiology by American College of Cardiology, Times of India Man of the Year Award. So the list is unending. It's a very long list. And recently he received DLIT in 2022, and he is also honorary professor of cardiology. And it is a very proud moment that Deputy Chief Minister of our Maharashtra, Devendra Fadnavis, and the ex-governor, Mr. Ramesh Bayas, have awarded at Rajbhavan, Mumbai. He has also various publications in his name. And today's our lecture is mainly on the recent advances and the innovations available at the Ruby Hall Clinic. So you will be wondered, मी तुम्हाला सांगतो sir, today all across Maharashtra the practitioners have joined this platform. Satara, Sangli, Karad, तुम्ही काल गेलेच होते, पण not only Satara, from the Konkan, Beed, Parbani, from everywhere the doctors have joined. आणि आता खूप सुंदर सुंदर त्या ठिकाणी टेक्निक्स त्या ठिकाणी रुबी हॉल मध्ये अवेलेबल आहे. ते आपण सरांच्याकडनंच ऐकलं, एक कार्डियक अँजिओ दॅट कॅन बी परफॉर्म इन 1 सेकंड. और MRI आपण बघतो की 30-35 मिनिटं लागतात, बट द फास्टेस्ट MRI machine is available at Ruby Hall Clinic, which can perform MRI in just 3 to 5 minutes with a very less radiation. Then recent advanced techniques like CyberKnife and all these things are available. So sir now will address and he will tell us regarding the recent techniques and the innovations available at Ruby Hall Clinic. So over to you, sir. And it is I'm very glad you are here.
Where's the pointer? First of all,
Let me share the screen.
1 second.
Yes.
Slides are visible.
Yes, sir.
Yes, visible, sir.
You can all see the slides. Wonderful.
Correct.
Okay.
Yes.
Just
So, first of all, thank you for inviting me here today. I'm very happy to be with all of you. And yesterday, I don't know, a lot of you all came to Karad to listen to me. I drove down to Karad and I gave a lecture there. We finished at about 10:30, 11 at night. Came back. I was back at work at again 9:30. So it's a long, tiring day. But I'm so happy that all of you all are here and listening to me. Today, I'm going to talk about new technologies in healthcare. So to be successful in medicine now, you must innovate all the time, because if you don't innovate, you'll fall back. Why is Ruby Hall doing so well today? In fact, yesterday I was surprised. The lounge was so full, it was hardly difficult to even walk into Ruby Hall. We're getting patients from all over the world, not only Pune, Maharashtra, India, and now from all over the world, because of the new technologies that Ruby Hall is bringing into our society. And remember, Ruby Hall is a charitable trust. It's not for profit for making. Whatever money Ruby Hall makes, it puts back into technology, innovations, and machinery. A little bit about Ruby Hall. This was started by my father in 1959 as a 2-bed hospital. And today I am very happy that my father started it. My dad started Ruby Hall by taking a loan. He bought it for 4 lakhs of rupees. And today I don't know what the value is. I'm not even going to talk about it. But Ruby Hall today has a total of 900 beds. We have 5 hospitals. We have the main hospital. We have the Vanauri, Hinjawadi. We have taken over Manikchand Hospital, Shirur, where we have now put a cath lab and are renovating the whole place. And Chakan Specialty Hospital has also been taken over. As you have mentioned, we have many diagnostic centers all over Maharashtra, starting from Parbhani in the east to Satara and all the way down to Belgaum. So we have 22 centers all over. Each one has got an MRI and some of them have got a CT scan. Ruby, of course, is very well known for cardiology. The first angioplasty in India was done at Ruby Hall, and this was done in 1987 by myself. Since then, Ruby Hall has done more than 150,000 angioplasties. And yesterday, in one day, we put in 26 stents. So you can see, normally for cardiology, we get complicated cases. Most of the cases that have come to Ruby Hall have been done before or had a problem and we've had to sort it out. For cancer, we have one of the largest cancer centers in the private sector. We have got 180 ICU beds in main Ruby Hall. 180 ICU beds and another 20 are being added. So we will have 200 ICU beds, all with ventilators in the main hospital. Now, let me talk about the new things that are coming into or have come into Ruby Hall. The first is the hybrid cath lab. Now, what is a hybrid cath lab? A hybrid cath lab is a lab that is used for doing angiography, but the entire lab becomes a theater in case of a complication. So suppose you are doing an angiogram or an angioplasty and something goes wrong. Within 2 minutes, I can put you onto bypass surgery. So basically the lab is a theater. There is only 1 or 2 labs in whole of Maharashtra who have got a hybrid cath lab. We use it, see, 1 in 5,000 cases of angioplasty is going to get into trouble. And when you get into trouble, you have a hybrid cath lab, the patient will survive. Of course, it costs double the cost of a normal cath lab, but we needed it because Ruby is one of the best units in Maharashtra in cardiology. In the hybrid cardiac, we can do cardiac surgery, vascular surgery, neurosurgery, spine surgery, and thoracic surgery. And you can see what beautiful pictures we get of the coronary arteries using this high-end cath lab. See, you can get a cath lab for 60 lakhs and you can get a cath lab for 15 crores. This machine costs nearly 15 crores. But then we need this technology at Ruby Hall. Now, also we have got what is called a stent boost. So once you put the stent in, we come to know exactly whether the stent has been put properly. So this is the stent boost you can see there, where we find out in the new cath lab where the stent is properly expanded or not. We have also got this new technique called dynamic coronary road mapping. Means what happens is you can see that you get this red marking comes in. As you do an angiogram, the entire red things comes into the focus. And then the operator has to simply put the wire down. As you can see the wire going down. So it's like Mickey Mouse. It makes life so simple that you can wire the coronary arteries. You can wire it very easily and you know exactly where you are. So this helps to increase the speed of angioplasty. We also have what is called as intravascular ultrasound or intravascular ultrasound. And this is going into the coronary arteries. That means you can take a little pipe and go right into the arteries and you can see where the calcium is, where or not, like a normal artery is on the left-hand side, there's no calcium, there's no blockages. And here you can see all the calcium in the coronary artery. So we can pick up things like this, which we never saw before. We also use OCT. Now, as you can see over here, This is after a stent has been put in. There's a beautiful area around the stent. That means the stent has been very well opposed. As against in this case where you see there is a little flap sitting there. Now, if you have not done IVUS, then you would have, or OCT, then this particular stent on the right-hand side will definitely get blocked in a very short period of time. So OCT is now used routinely after doing angioplasty, where you know your stent is very well opposed and your stent is not mal opposed. So it is very important to check that the stent has been put properly after you have done angioplasty. We have also got a navigator, what is called as heart navigator in the cath lab, and this is mainly used for TAVI procedures or transaortic valve replacement. Now, if you are above the age of 60, we feel that all patients should go for TAVI procedure rather than cardiac surgery. And you can see over here that this machine will tell us exactly what is TAVI? TAVI basically is nothing but a stent that is put in the aortic valve, making it very simple. So nowadays we have done more than 1,000 TAVI procedures at Ruby Hall. And this is the aorta. And you can see the TAVI valve or the stent that is put in the aorta. This is done percutaneously. So there is no surgeries involved. It takes only 40 minutes and it's a fantastic procedure. So all patients who need aortic valve surgery should go for TAVI above the age of 60. Below the age of 60, we recommend aortic valve surgery done by the surgeon because now the new valves have come in. Remember, when you do heart surgery for aortic valve, there are two types of valves that are available. One is a tissue valve and the one is a metal valve. Metal valves have a problem because they need blood thinning. So you have to give them warfarin or you need to give them acetone. In tissue valves, you do not need blood thinning. Maybe you can use blood thinning for a couple of months and then go on to simple aspirin or clopidogrel. Now, the new tissue valves that are coming are lasting for more than 25 to 30 years. So more of us are shifting to tissue valves. The only problem with tissue valves, the modern valves they are much more expensive. You can get a tissue valve for 1,30,000, 40,000, but the better ones can go up to 5 lakhs, the cost of the valve. Most of these valves are American valves, and nowadays, those who can afford it, we are putting the better quality valves. Ruby Hall is also one of the first hospitals to have a biplane cath lab. That means you have got two planes. You've got one plane like this and another plane like that. Now, that means basically it's a double cath lab instead of a single cath lab. So it's double the cost. But the advantages of this are phenomenal. We can, if a patient comes early to the Ruby Hall clinic and you have a thrombus in the artery of the carotid artery, we can simply go and remove the thrombus using this new biplane cath lab. We can also put in stents, like you see here, in the brain arteries. So we can put in stents in the arteries of the brain. So these are the new technologies that can be done. Here you can see wiring the artery of the brain, and then you put a stent inside. So this is also a new technology that is now available only at Ruby Hall in Pune. I don't think even Bombay has a biplane cath lab, or maybe they may having one. As far as cancer goes, we have made huge progress. And I'm very happy to inform you that we have introduced the CyberKnife. Now, what is CyberKnife? I'm going to tell you a little bit. CyberKnife is a robotic treatment which is used in the treatment of cancer. It is used in very specific areas because what it does compared to a normal linear accelerator, in a normal linear accelerator, the beam is a little big. In CyberKnife, it is very focused and pinpointed. So I'm going to show you what a CyberKnife does basically. This is a cutting edge technology. There are only two machines of CyberKnife in India. One is in Ruby Hall and the second machine is in Chennai. The treatment of a CyberKnife takes about 20 minutes only, and it's a very expensive machine. The machine costs nearly 50 crores. We got a donation, that's why we have this machine in Ruby Hall. If you have a tumor like cystic neuroma or a tumor of the ear, you just hit it with CyberKnife, it destroys the tumor completely, and you need one sitting or two sittings of 20 minutes each. Your trigeminal neuralgia will also work beautifully. It works on the principle of AR. So the entire planning takes place on an MRI or CT scan, and the patient goes into the CyberKnife or radiosurgery treatment, and it destroys the cancer completely. Suppose you have a tumor near the eye, then you want to protect the eye. So you hit the CyberKnife and it will destroy the tumor. We have kept the cost of CyberKnife very low, between 3 to 3.5 to 4 lakhs is the cost of the treatment of the full treatment of CyberKnife. So we have already treated nearly 500 patients in the first year of the CyberKnife, and it's very safe, it's comfortable, and 20 minutes is all that's required. Patient walks in, walks out. So this technology, I'm very happy that Ruby has got. As far as the variant machines are concerned, we are treating nearly 200 patients per day of cancer on the other machines that Ruby has. So I am happy to inform you that now we have become the largest cancer center in the private sector in India. We have also got what is called as the Da Vinci robot. The Da Vinci robot is a robot that is mainly used for prostatic work, but it can also be used for all abdominal surgery. The Da Vinci S1 is the present moment machine that we have, but now in June we will be replacing it with a brand new machine. It is called as S7. So we have done nearly 800 patients using the Da Vinci surgical robot. You make two tiny holes in the abdomen. In one, the robot goes, and the other, the rest of the machinery goes in. And it takes about 4 to 5 hours for each surgery. The results are simply fantastic. This is also a new machine that has recently been installed in Ruby Hall. It's called Resum. Resum is a brand new technique used in the treatment of prostate. So it is used for benign prostate treatment. If you have a prostate problem, now what we do is the Resum consists of a simple catheter-like substance which goes into the prostatic area. Once it goes in there, it vaporizes the prostate. So what happens is the simple catheter goes in, it vaporizes the prostate. The catheter is kept for 5 days and it's taken out. The great advantage of this is there is no surgery at all. There is no cutting. There is no bleeding. It's a fantastic procedure. We have done about 14 cases so far because the machine has just come in, and it is FDA approved also. Now it is very good for patients who are on blood thinning tablets or patients who are on aspirin or clopidogrel or any of those because there is no bleeding only. So all these patients should be treated with this Resum treatment, and it just simply vaporizes. The only problem is you have to keep a catheter for 5 days, which is not so bad considering that there is no surgery involved. So this is a new treatment that all of you should know. And my surgeon, Dr. Gandhi, has been using it quite frequently. Now, as people come to know more and more, they are going to use this treatment more and more. So this is the simple, it is totally minimal invasive treatment, and especially people who don't want surgery. The other great advantage of this treatment is there is no retrograde ejaculation. When you do a prostatectomy medium-low, there is retrograde ejaculation that takes place, which is a nuisance, and people don't like it. But in this treatment, there is no retrograde ejaculation at all. So the patient is fine and superb treatment. So this is before and after. We also have the best lithotropy machine for kidney stones. And instead of giving large shock, this machine gives gentle shocks where we do kidney stones. There are only 2 machines available in India. One is at Ruby Hall and the other one is in Delhi, where it gives you beautiful treatment of the removing the kidney stone without damaging the kidney at all. I would also like to inform you today that we have installed in Ruby Hall 6 months ago the best laboratory in the world. This laboratory is interesting because it can do 2,500 tests in an hour. It's totally computerized, totally online. And this was inaugurated by my very close friend Rajiv Bajaj that you see on the right-hand side. He's got a nice smile on his face. Now, what is the specialty of this lab? What it does basically, from the ward, the sample is shot directly through tubes into the lab. So there's no ward boy collecting the samples, taking it to the lab. It just goes from every ward, including the ICU, CCU, is automatically connected to the lab through chutes. Within a second, the sample can go into the lab. The lab then gets the sample and starts processing the sample. The sample runs on an electric train-like system. I'll show it to you now. You can see what it does. The sample runs on a conveyor belt system. And this is the sample doing the laboratory work. 2,500 samples go in. They are coded. And at the end of it, you get the report completely computerized and online. So it requires nearly 8,000 square feet of work space for setting up this lab. This is the same lab that is used in Mayo Clinic, Cleveland Clinic, and large hospitals in America. No hospital in India has yet got this lab. Only Ruby Hall has got this sophistication and of its lab. So it makes our life very simple. We get our results immediately, and it's a big boon to everybody. Nowadays, we are getting samples from a lot of other smaller labs for getting the samples done at Ruby Hall. So all smaller labs in Pune are now sending us samples for using in this current lab. So it's quite a sophisticated lab. We also have got a digital PET scan, which we have been having for the last 4 or 5 years. The advantage of a digital PET scan over a normal PET scan is that the accuracy of diagnosing cancer goes up very high. So we are doing nearly 2,000 cases on this PET scan in a month. And it is much better than having a normal PET scan. That most hospitals have a normal PET scan because it is much cheaper. A PET scan can be bought for 6 crores, a brand new one. But ours is a 22 crore PET scan because we want sophistication and we don't want to miss any tumor. We've also now in the process of buying the second PET scan, which will become the fastest PET scan in the whole of India, and that will be installed working in June. Now, this is the most interesting thing that has come to Ruby Hall, and all of India is talking about it. Not only all of India, but all of the world is talking about it. Ruby Hall has installed the world's fastest CT scanner, which does a full cardiac scan in few seconds. And I didn't expect it to do so well, but every day I am now doing 110 CT scans per day. Patients are coming from all over the world, from Dubai, Hong Kong, Singapore, Kashmir. One patient came from Canada, another one from Australia. And what is the advantage of the CT scan? Okay, first of all, it's the fastest in Asia, and nobody else has it. A normal CT scan can go up to 180 or 170 cycles. Ours goes up to 1,152 cycles, making it the fastest in the world. Now, this is the scanner from inside, and it's got a dual source. Now, what is the advantage of this scanner over a normal scanner? You're going to ask me, Parvez, why is it so good? Okay, number one, I can do a scan at any heart rate. Even if your heart rate is 120, I'll get your cardiac scan done. Number two, any arrhythmia, we can do the scan. Number three, no beta blocker is used at all, as against the older scanners where we had to wait 2 hours, heart had to slow down. Radiation dose is like taking 1 X-ray. On a normal CT scan, don't forget, you're radiating your patient to 40 X-rays. Normal CT scan today all that the machines you have got all over Maharashtra is like taking 40 X-rays. So you're radiating your patient heavily. I am radiating it to one X-ray. So the radiation level has come down phenomenally. No sedation is required in pediatric patients. So the other huge addition is that in children, you can do a full scan in 1 second. So they don't need an anesthetic. So we're getting a lot of children coming for doing the CT scan because there is no anesthesia required at all. The patient goes in the machine, 1 second is out. And the other thing is that the dye, normally we used to give 100 mils of dye. In this machine, we give only 20 mils of dye. It's a great advantage. This is because it is a dual source CT scan. The other day, the professor from Mount Sinai in New York came to Ruby Hall and I showed him the scanner. He said, Dr. Grant, I cannot believe the technology you have bought in. We have placed the order for the same machine, but our delivery is more after 6 months. So you have beaten us. You have beaten even the US in getting this machine first. I said, yeah, there's a waiting period of 1.5 years now for this scanner because they can't produce enough of it. So this is the brain in the CT scan. And what you see here is a aortic stent, a stent in the aorta, or beautifully demonstrated in the CT scan. Here you can see the renal arteries demonstrated in this new machine. Remember, all these scans only take 1 second. And now people are coming in hordes. They're coming, 10 people are coming from various towns, getting together, hiring a bus, coming, getting the CT scan and going back with the report. So this is a normal coronary artery, which you can see beautifully demonstrated. So now if you have a symptoms, there's no need to do an angiogram. You simply do a CT scan. If a CT scan is normal, end of the problem. If the CT scan shows mild disease, end of the problem. CT scan shows major disease, you go for angiography, followed by angioplasty. Now here is a patient who has had a bypass graft surgery. You can see each particular graft that the surgeon has put in. This one, that one, and all that. So these are the beautiful pictures which you never saw before. See all these grafts that the surgeon from the aorta has connected. So all these type of pictures you are getting with this new CT scan machine. You can also see everything in color of your coronary arteries, which you never saw before. Here you can see some calcification seen in the coronary arteries, which is also there. Here you've got a stent. Now this stent is patent over here. So this has got one stent there, it's got another stent there and another stent there. So you can also see whether the stents are functioning well, whether the stents are blocked, whether there's any problem with the stent. Here, if you see very carefully, there is a dissection of the aorta, but I'll show it to you in another slide as we go along. Now, this child had to have, it was a child 4 years, obviously didn't want anesthesia, came to Ruby Hall. We did the CT scan in 1 second and no anesthesia required. Came in, did the thing and the patient went out. So this patient was diagnosed as partial anomalous pulmonary venous drainage. You can see the venous drainage over there and patient no anesthesia. So diagnosis was done immediately. Here you have got a complete aorta which is blocked at the distal end. There's no flow down the aorta. So this patient needs very urgent surgery. This is a very interesting case. I must talk to you about this. This is a friend of mine. I won't tell you his name. He's within the top 2 richest men in Pune. Previous night, he was in my house. We were sitting and talking till 11 o'clock. Then he flew in his private jet, went to Delhi. In Delhi, he was in a restaurant at around 10:40 in the night having dinner. When suddenly I got a call saying, Parvez, I said, what happened? I've got a brick on my chest. I said, stop fooling around, yaar. What a brick on your chest, disturbing me at 10:45 in the night. He said, no, I'm very serious. I have a brick on my chest. I don't know what to do. I said, don't give me some shit. My typical, no, Parvez, I'm very, very serious. I said, go and get an ECG done then. He said, no, I'm feeling choking as well. I said, okay, Baba. So I called my friend in Delhi and I said, Ashok, he's the head of one of the large hospitals in Delhi. I said, go and see my friend as big boss. So he said, I've got COVID, I can't go, but I'll send my junior. So I sent this friend of mine to the hospital there. They sent an ECG back. The ECG was normal. I said, then why you're complaining? I said, he said, no, I'm feeling very bad. I said, do an echo. They sent me the echo. They missed the diagnosis. On the echo, I could see a small flap because they sent it to me on video. By the time it was nearly 1 o'clock at night. I said, I think there is a problem there, but you need a CT scan. They took them 1 hour, 2 hours to get a CT scan. By that time, it was 2 o'clock. When they got a CT scan, they got a shock. They found there was a large dissection. See the double shadow there? This is a double shadow there. He was dissected. I said, by God, you're right. You're a very serious problem. Now I said, you have to be operated within 5 hours, because if you are not operated in 5 hours, you're going to die. So we had to, unfortunately, the hospital where he was, the surgeon had also COVID. And I didn't know what to do. By the time it was 2 o'clock at night, then I rang my friend in US, Dr. Sharma, who's head of Mount Sinai Hospital. And I said, Samir, what the hell do I do? This man is going to die. He's such a VIP guy. He said, no, you send him to this place. I know the surgeon there. So I called that surgeon. He didn't answer the phone. It was 3 o'clock at night. So now what to do? Then with great difficulty, we sent a vehicle to his house, woke him up. But he said, I am also positive COVID. So I couldn't even shift him. Now we were in trouble. I said, you have symptoms. Then the surgeon called me. I said, you have symptoms? He said, no, I don't have symptoms. I said, then you please go to the hospital. I'm sending this patient to you and operate in the middle of the night. They'll operate by 5 o'clock or 6 o'clock. Then what happened? The patient was shifted to this next hospital. And it was 6 o'clock. Of course, they were ready to take him up, but they wanted money. अभी पैसा 6 बजे सुबह को दिल्ली में कैसा पैसा भेजने का? Another headache. So I told him, this guy is very important. अरे साहब, अमिताभ बच्चन भी बोलता है हम अमिताभ बच्चन है. Other fellow says, I am this, I am that. पैसा भेजो फिर हम ऑपरेशन करेंगे. So from my own account, I had to send 10 lakhs. So this guy is a billionaire. And finally, when they found out he was a billionaire, then they all woke up. So the surgery went off well. Patient did well, and he's doing extremely well. Now it is, this is the 3rd year of his surgery. And this happened 3 days ago. I mean, the 3rd year got completed. So this friend of mine rings me at 10:45. He said, Dr. Grant, thank you so much. This is exactly at 10:45. I called you 3 years ago, and I'm still alive. Thanks to you. Thank you very much. So these are some interesting cases. Here you can see that there is a large tumor. This is a 14-day-old kid, again put in the CT scan, and within few seconds was out of the CT scan. Diagnosis was made and treatment was started. This is a patient who had an infarct of the brain. Here you can see the cochlea, how beautiful it is shown in the new CT scan. Here you've got the lung, and you get emphysema, fibrosis, and so on and so forth. Now, the advantage of this CT scan is also very important, because I had a friend of mine, again, who's a very rich man, who required 5 CT scans in 1 month for recurrent pneumonias. And because it was only one X-ray, like radiation, he could withstand this recurrent CT scan. Remember, the X-ray gives you good vision, but the CT scan gives you fantastic vision. So this is something that is a big advantage. Here you have got the fat liver estimation. This is a patient of gout, where you have got gout crystals. Can you see these purple crystals? So this is on the new CT scan. If the patient has got gout, you can actually see each crystal of the gout patient. This is a marrow showing edema. I won't waste time. But this is something interesting. Now you see the lung. Now we can actually go into the lung without bronchoscopy and finding the tumor. Now this is called as visual bronchoscopy we can do. See the visual actually going into the lung instead of doing bronchoscopy. Over here is the stomach, and here you can see the hiatus hernia also. So this is another huge advantage. Can you see that? This is a reflux into hiatus hernia. The thing is going up and down. So things like this, which we could never diagnose before, on the new CT scan, we are able to diagnose and treat. The other thing that we did very interestingly, we have this machine to do a creatinine before the patient goes into the CT scan. And this gives a result within 2 minutes. So there's no wasting time. Patient comes, gets his creatinine done. If the creatinine is more than 2.53, we don't like to do the CT scan. If it is less than that, we do the CT scan. And within 5 minutes, we can send the patient out of the, after doing the complete testing. We have also installed the fastest MRI. It is called as Evolution 3 test. It's got smart speed. And what is the advantage of this MRI? The advantage of this MRI is the first in India, first of all. It does a full MRI scan within a few seconds, and I'll show you. This is the normal, this is the fast speed MRI. What you see, I'll show you some interesting cases. Now, it does an MRI knee in 7 minutes as against 25 minutes. It does an MRI stroke protocol in 3 minutes. It does MRI shoulder in 6 minutes. We have also got MRI elastography. So you can see any fibrosis or anything in the liver. It is much more sensitive than doing a simple ultrasound. So this is used quite a lot. At this stage, I would like to inform you that today we have the best liver team in India. Every alternate day, we are now doing a liver transplant. And I must say, Manoj Srivastava, who's leading this team, is a fantastic surgeon. Success rate is more than 98% of liver transplants. And I must congratulate him for his superb work that he's done. We have set up a full liver ICU of 25 beds now at Ruby Hall Clinic. Here is MI trachography. So this machine is very good because it does a full MRI in 5 minutes instead of 35 minutes in a machine. So you can see we are doing functional MRI. This is MRI cysternography. Then here you have got a tarsal tunnel syndrome, where you've got tarsal tunnel syndrome over there. And this is MRI lymphography. We are the only hospital in India that does MRI lymphography. So all these are the new things that are coming out. This is a patient of hypertrophic obstructive cardiomyopathy. You can see the muscle wall is quite thick over there. So hypertrophic cardiomyopathy is diagnosed in this case using MRI. So we are using this MRI now a lot in patients with all sorts of cardiac problems. This is another very interesting case. This case came from Karnataka. This man, poor chef, poor fellow, had came with me for a pericardial effusion. He was tapped twice outside in another hospital, and every time it started filling up. And finally, somebody told him, you go to Dr. Grant at Ruby Hall, and they'll sort you out. When we did the echo, we suspected amyloidosis. That is a restrictive cardiomyopathy. Then we put him for the MRI, and the MRI clearly showed that he had got amyloidosis. The patient was operated for pericardectomy. We removed the pericardium, and now we have started treating him for amyloidosis. He's still in the hospital and will be discharged soon. So this is constrictive pericarditis. This is an arrhythmogenic heart. So this patient is coming with recurrent ventricular tachycardia and ventricular fibrillation. This is because there's some area of the heart has got scarred. And because it has got scarred, it's producing irritation, causing VT and VF. So this is another diagnosis that we picked up using our new machine. This is a thrombus sitting in the left ventricle. Now, this is a new machine that Ruby is going to get shortly. It is called as MRI-based LINAC. This is a technology where in a MRI machine, you can radiate a patient. This machine, there are only 70 machines in the world, and there's not a single machine in India yet, but I think one has just started in Hyderabad. What it does is it targets the radiation in a machine. So when you have got certain types of cancer, like pancreatic cancer, you can treat the pancreatic cancer with radiation. and fantastic, this thing. The only problem is this machine is very expensive. It is a 100 crore machine. So I'm trying to find ways and methods of funding this MRI-based LINAC. So we have to make a bunker and then put this machine in. And we are at the final stage of closing the deal now. We have also been the first machine in the whole of India to put a cyclotron. A cyclotron is like a nuclear reactor and it produces a lot of radiation. So the advantage of a cyclotron in a hospital which has got a PET scan is that you can do many tests that no other hospital in India can do. And Ruby Hall, the machine has already come. Within a week, it is starting, and we'll be the first hospital in the whole of India to have cyclotron. Now, what does a cyclotron do? Cyclotron produces FDG, which is used in PET scanning. Nowadays, the FGG from Pune comes from Bombay. But when it comes from Bombay to Pune, the half-life gets destroyed. So half of the FDG gets destroyed by the time it reaches Pune. So I decided to put a cyclotron. Cyclotron is made in by General Electric of America, but it is made in Sweden. It came in 40 trucks because the cyclotron comes with its own protection of radiation. So it comes with its own concrete. So what you see here is the concrete around the cyclotron. In addition to this, we have to build a bunker which has got 10 feet thickness walls. So there are two layers. One is the cyclotron has its own protection of concrete, and then we put another concrete of 10 feet around it of radiation so that no radiation ever leaks out. Because if radiation leaks out, Pune will be in trouble. So they are very strict in their protocol criteria. But having said that, we have installed this machine. This is the actual picture of the machine installed at Ruby Hall. It took us 1 year to get it perfected. Radiation proof, radiation leakage, everything. And now it will be again checked by the people from Bombay. And then when we get the final permission, this will start. So this is a phenomenal technology. It will put Ruby Hall ahead of everything. For gastro, we have introduced this new machine. I don't know much about it, but my gastroenterologist told me what this machine does is it does gastroscopy, but it's color coded. So it tells you where to take the biopsy from the cancer. The cancer area comes in red, where he goes and takes the biopsy instead of just taking it from all over the place. So this is a very specific technology that this is only installed at Ruby again. So this is a patient I did 4 days ago. I did his angioplasty. His hemoglobin was 14 grams, but he started having some pain in the stomach. When we checked his hemoglobin, it came down to 3. So basically, he had what is called a Mallory-West tear. We rushed him to the gastro department where they did a hemoclip and they put a hemo spray and stopped the bleeding. Patient is fine. And 4 days later, in fact, today he's gone home. So at Ruby Hall, we have a luxury suite. So if you want comfort, you can get beautiful suites like this. This is better than the Ritz-Carlton suite. It's also got its own lift. So we have got luxury. We look after the poor people. We look after the general ward, the semi-private, private, deluxe, and now we have luxury suites. We have 8 luxury suites, and I don't know, all the suites seem to be full all the time. So people are affording and they want to come to Ruby Hall because they get the best treatment here. I have also set up a complete management building at Ruby Hall, where this is an 8-story building. No patients are there. It's only management building with 2 basements. We have got sewage treatment, water treatment, central AC, diesel generators, nearly 3 megawatt, synchronizing panels, and so on and so forth to make your life comfortable. Coming shortly, we are setting up the Amanora Hospital. Already the basement is done. This is a 300-bed hospital with a helicopter on the top. I think one person is planning to donate a helicopter to me. I hope he does. We do a lot of charity. We do nearly 30 crores of charity every year, and last 4 years, we have done 100 crores. All patients below the age of 16 or 18 who are poor and have cancer, children, will be treated completely free of charge in the CyberKnife and in the linear accelerator. So all children below 18 will be treated free of charge in as far as radiation goes, including CyberKnife. This little girl wrote to Modi and said, our Prime Minister, and said, I am only 8 years old. I have no money and I need heart surgery. So our Prime Minister wrote to the collector. Collector called me. We got the surgery done. When our Prime Minister visited Pune, he called me and he called the girl and simply said, thank you so much. The Pune metro station is now named as Ruby Hall Metro Station, one of them, the one next to Ruby Hall. And from the metro station, you can take a direct lift, which will go straight to the hospital. You don't have to get out of the metro. So Ruby has a lift which goes into Ruby Hall. And we are happy that the metro station is named after us. The great advantage of the metro station is that 30% of our staff now come by train, so that parking space has been liberated at Ruby Hall. We also set up at the Shivaji Nagar Court metro station a beautification garden, which we have done. We were the largest facility during COVID in Maharashtra, and in one day we had 600 COVID patients. Out of that, 110 COVID were on ventilators. So you can see the capacity of Ruby Hall. We have completed 38 heart transplants. We are doing liver transplants one every alternate day, 3,500 renal transplants, and over 100 bone marrow transplants. We're getting a lot of patients from all over the world, especially for the CT scan. Recently, 3 days ago, Rizwan Sajan is chairman of Danube Group, the 4th biggest builder of Dubai, came with himself and his family, flew down. Every day we are getting 5 to 6 patients from Dubai, Singapore, Hong Kong, Kashmir, Orissa, and all over. At least 25 patients have come from Delhi for the CT scan as well. So we are getting patients from all over the world for this new technology that Ruby Hall has introduced for the first time in Asia. I'm very happy that the government of India has nominated me as National Advisor to Minority Commission of India. Well, I don't know if you know what is the Minority Commission, but we are responsible for looking after the welfare of Muslims, Sikhs, Parsis, and Jains. So these are the minority community of India, and I'm appointed now at the central government level. I thank you very much for inviting me to talk to you for this little small presentation that I have done today. I hope you have seen the new technologies that are available to you, which you should use to benefit yourselves and your patients. Thank you very much. Thank you.
So thank you very much, sir. It was indeed a very nice presentation. And there is a very thin line between good, better, and best. So whenever we want some treatment backup for ourselves or for our family patients or our family members, so always I will advise you to choose the best hospital. And as rightly you have said, the Ruby Hall has the best facility among all the hospitals available in Maharashtra. So if you have any questions or queries, you can raise your hand and you can ask the questions, or you can interact with the Grant sir. So it is your lifetime opportunity to interact with the legendary person.
Okay, I'll be very happy if anybody wants to ask any questions on any of the new technologies that we have brought in. We have kept the pricing of the CT scan very low. It was same as before. For a full cardiac CT scan, it's around 16,000. If a patient is very poor, I'll do it at 12,000 also. So this has been specially kept because this machine is a very expensive machine. It costs more than 25 crores. So we have had to keep our pricing very low. We have not changed it from the old CT scan pricing. Even the MRI pricing has been kept extremely low so that everybody can use these technologies. Anybody else wants to ask any questions?
Dr. Abhijit, do you want to ask? Please unmute yourself. Dr. Abhijit. Okay, anyone else?
Okay, Sandeep, does nobody else want to ask anything?
Rahul? Dr. Rahul?
Hello,
Okay, sir.
hello,
Yes.
Yeah, go ahead.
hello.
Yeah, I can hear you.
Yes, sir. I am GP practitioner. I want to ask one question. Is what is difference between sir pacemaker and LVAD? And yes, is LVAD facilities available in Ruby Hall?
Yeah, we have LVAD facilities. LVAD
Okay.
is mostly used for patients who are waiting for a heart transplant. So it's not easy to get a heart. So
Hmm.
while you're waiting for an LVAD is a machine that keeps you alive for a specific period of time till a heart is available for you for transplantation. Having said that, some patients have been alive on an LVAD for more than 10 years. So it is basically a life support system. It has a battery which has to be charged, and the patient lives on the LVAD. So this is a temporary method of keeping somebody alive till heart transplantation takes place.
Cost of therapy, sir?
Sorry, LVAD is expensive. It costs nearly 60 to 70 lakhs, or maybe a little more. It's very, very
Okay.
expensive technology. It's not cheap. And then
Okay.
you have to keep various things to keep the machine going as well. So it's not something that is used that frequently. There is Dr. Bala in Chennai who has got nearly 70, 80 patients on LVAD. He's one of the highest transplant surgeons in the world. And finally, 4 days ago, we have signed a contract with him that he'll be doing all his heart transplants, which are not available in Chennai. He'll be doing it at Ruby Hall now. So Bala and I have signed a contract to do all the heart transplant. There are 70 patients on, your battery is running low. There are 70 patients on wait list in Chennai. Can you hear me?
Okay,
There
okay,
are
sir.
70 patients on wait list in Chennai. And in Pune at Ruby Hall, so far I have a list of only 6. So you have to have the same blood group while doing it. So if you've got 70 patients waiting and I've got 6, so I've got 76, which I've got ready to transplant. Because when a heart comes, everything has to be ready. There are very few units that do this type of heart transplant. Heart transplant we are doing at Ruby 1 a month now, but slowly we are going to ramp it up. We have done 38 so far.
Okay. Thank you, sir.
Thank you.
Dr. Sajid?
Yeah, thank you very much, sir. I'm sending many patients to Ruby and sir is supporting a lot. And the case which sir discussed about his friend in Delhi, the similar case I had, and hearing sir's case, I could save that patient. So thank you, sir, a lot. And Ruby Hall is doing best and sir is best.
Thank you so much. Thank you. Appreciate it.
Dr. Ujagre? Okay, Dr. Yogesh?
Sir,
Hello.
very good afternoon, sir.
Sorry?
Hello.
Yeah. Go ahead.
सर मैं यहाँ पे एक रूरल एरिया में प्रैक्टिस करता हूँ नासिक जिले में।
हाँ.
तो मेरा एक सिंपल क्वेश्चन था सर कि अभी ये जो भी वॉल रिप्लेसमेंट वगैरह होती है, तो
हाँ.
पहले वॉल रिप्लेसमेंट के लिए तवी वगैरह नहीं था, अभी वो रिसेंटली हुआ है, शुरू हुआ है, 4-5 साल से तवी का आया है। तो सर पुराना जो था उसमें और तवी इसमें कुछ डिफरेंशिएशन है, या दूसरी चीज ये है कि अगर वॉल रिप्लेसमेंट करना है किसी का तो कैसे तय करें कि इसको तवी से अच्छा रहेगा कि कैसा रहेगा?
So every valve replacement जो भी रहता है is different. Remember, no valve is replacement is the same. So there is aortic valve, there is mitral valve, there is tricuspid valve, there's pulmonary valve. So there are 4 valves that you need to look at. Coming to aortic valve, I made it very clear. If the patient is less than 60, he should go for open heart surgery and put a nice tissue or metal valve. If he's above 60, then if the parameters are okay, the treatment should be TAVI or trans-aortic valve replacement, means putting a stent in the aortic valve. Coming to mitral valves, if the mitral valve is narrow, it is called as mitral stenosis, where the valve is narrow. You simply put a balloon, open up the valve, and the patient will be fine. If there is regurgitation of the mitral valve, then again there are two methods of treating. One is surgical, you go inside and replace the mitral valve, patient is fine. Or the new methods are available when there is mitral regurgitation, where we go in and we actually percutaneously, that means without surgery, repair the mitral valve. So you can repair the mitral valve also. Unfortunately, that device for repairing the mitral valve is very expensive and it goes to about 40 lakhs. So we have done only 3 patients of mitral valve repair in Ruby Hall using the non-invasive technique, that means not cutting. Cutting technique is very simple. You just go, surgeon either repairs it or replaces the mitral valve. Coming to the pulmonary valve, if the valve is narrow, you just put a balloon and open it. Coming to the tricuspid valve, you may able to repair the tricuspid valve while the surgeon is in the heart itself. So it's easy to repair the tricuspid valve. So valve surgery is completely different from bypass surgery. A completely different kettle of fish. But it is done routinely. We do we do about 2 to 3 open hearts every day at Ruby Hall. And of course, angiographies we do sometimes 25, 30 angioplasties. We do about 12 to 14 angioplasties every day. Mostly we get complex cases coming to Ruby Hall. But remember, if you've got a valve replacement, aortic valve done, say 20 years ago, the valve is getting narrowed, and you can put a stent in the valve also. It is called as valve in valve. And we have done many patients where the aortic valve has been replaced 20 years ago. Now the patient has come back with the same problem again. And this time, instead of going for a second operation, we put a valve in the valve, which has been implanted. So that also we can do. So a lot of new things are coming in medicine and cardiology.
Yes, sir. Lot of new things are coming for everybody. This lecture is very nice, eye-opening. आपल्याला पण वाटतं की अरे आपल्याकडे सगळं आपल्याला लागलं ते आपल्याला मिळणार आहे. But all these things are very costly. So you should have good mediclaim with you and just see that the modern treatment is included in your mediclaim. आपल्याला बरेचदा म्हणतो की माझ्याकडे 5 lakh, 10 lakhs mediclaim आहे. But the 5 lakh, 10 lakh mediclaim is not enough. At least you should have 50 lakh to 1 CR of mediclaim.
Yeah, so my advice is that everyone should take mediclaim as far as possible, especially all doctors should be under mediclaim of some type or other, because you never know when you suddenly need mediclaim. And mediclaim is so cheap to get. And get a good mediclaim company, which
Yes.
gives you reimbursement quite fast without wasting too much time. Because you see that now the problem took place that, what is that one actor, Saif Ali Khan got
Saif Ali.
stabbed. And he applied for mediclaim. He got 25 lakh mediclaim immediately because he was a famous actor. What about a common man? So people are shouting, why should a celebrity get mediclaim so fast? And we have to wait 8 hours, 6 hours. Then they say, this claim is not approved, that claim is not approved. So go for a good mediclaim company that is flexible, you know. And they are also, I don't blame them. They are also, people cheat them all the time. So they also have to be careful. But I think it is only fair that it's give and take on both sides. Now, as far as Ruby is concerned, nearly 30% of our patients are on mediclaim.
Correct.
That's coming to Ruby Hall.
There
We get a
is-
lot of central government patients also coming.
Correct.
And we do a lot of charity also because we are a charitable trust. We are not a profit-making organization, basically. It all goes back to equipment. As you can see, why has Ruby Hall got such good equipment? Because we put the money back into the hospital. So what you are getting good treatment and you're getting better service and better treatment and better facilities. Because we want to be the best.
On the similar ground, you should put your investment on your health. So
Sorry?
many of Yeah, on the similar ground, doctors should put their money, they have and should put their investment on their health, own health.
Yes,
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 so
yes, yes.
take a good mediclaim of a good amount and always see the between the lines. Many of the time exclusions are there, always read this exclusion. Many of
Correct.
the time modern treatment is not included in some policy. Just check it with your provider whether it is available. So at the say crisis point, if you learn that my mediclaim is not covering this modern treatment,
Correct.
okay, then it is not the use. So this is the take-home message, and sir have addressed this August gathering very nicely. So for the vote of thanks, I request Dr. Mohite sir to give vote of thanks.
Okay, thank you, sir.
Mhm.
Dr. Pravesh Grant, sir, esteemed guests, and fellow medical professionals. I would look to extend my sincerest gratitude to Dr. Pravesh Grant, sir, for delivering an outstanding lecture on recent advances in the medical field at Ruby Hall Clinic. Your insightful presentation has not only broadened our knowledge but also inspired us to stay abreast of the latest development in medical field. Your expertise and passion for sharing knowledge are truly commendable. At AU Medline, we strive to provide a platform for medical professionals to share knowledge, ideas, and best practices. Your contribution to our academic pursuits is invaluable, and we are grateful for your support. Once again, thank you, Dr. Pravesh Grant, sir, for your enlightening lecture and for being part of our academic community. We look forward to future blessings, collaboration, and learning opportunities from you, sir. Thank you. Thank you very much, sir.
Thank you. It's my pleasure. Thank you very
Thank you,
much.
sir.
Thank
Thank
you.
you.
Bye-bye.
Thank you. Bye.